is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us. All right. Welcome back. So you see from our video that there are 30 very specific causes of back pain. Deuk Spine Institute, we're the first in the world to discover and publish all 30 causes of back pain. Those causes include 5 discs, 10 facet joints, the SI joints, the piriformis, fracture of vertebrae, which is very rare, and tumors, infections, coccygeal pain, which is your tailbone, very rare. So the most common cause of back pain, which accounts for 80, all right, so I'm doing this backwards. That's probably not right. 85% of lower back pain are discs, disc pain. So I'm writing upside down, and I apologize for it being so bad. 85% of back pain comes from disc injuries. That's what his back pain is coming from. He has a tear at L5-S1 within the ligament holding the bones together at L5 and S1 bones. It's called an annular tear, specifically posterior annular tear in the back of the disc to the side. He's got nuclear material that has migrated out through pressure and time, stuck inside the tear, causing inflammation and back pain. Same thing on the L4-5 disc. The L4-5 disc has the same problem, but it's on the opposite side. Everybody agree, left L4-5, right L5-S1. Yes. That's what we're doing. We have left 4-5, right 5-1. Any questions from the audience at this point?
No questions.
All right, I got to work on my upside down writing, but in the meantime, we're going to be performing what's called a discogram. Our patient discogram. Disco means the disc, gram means a test, like a imaging. Discograms can be either chromodiscograms, which is just injecting dye, or evocative chromodiscogram, where you're seeing if the patient experiences the pain they typically get in their back. If they do, we call it concordant. So I'm going to do a test on these two discs to see if he has concordant pain, which is his typical daily pain.
He said he's good.
Are you having any pain right now? Are you comfortable? How bad is that on a scale of 1 to 10? 10 being the worst pain.
Give us a number. 10.
Is that where you get back pain? All right, he had 10 out of 10 pain. It was horrible. He tensed up. It's concordant, meaning that's where he typically gets it. Is it better?
Yeah.
All right. Are you comfortable now? How bad is that pain on a scale of 1 to 10? 10 being the worst. You heard him. 10, 10, 10, he said. So we're done testing your discs. They're both concordant. Is that where you get your back pain? All right, that pain will be gone when you wake up, gone for the rest of your life. How does that sound to you? I couldn't hear him. What did he say? How does that sound to you? He can't wait. That's his quote. He can't wait. So, he can't wait. That's how happy he's going to be. He wants that pain gone. Most people want their back pain gone. The problem is doctors don't know how to get rid of back pain because for most doctors, the back pain is a big black box. And black box just means they have no idea what's inside the box, what's causing it. That's why it's called a black box. Black box just means they can't see inside. They have no idea what's going on inside, right? So imagine if you took a microwave and you stuck a burrito in it that's frozen and took it out, and somebody's never seen a microwave, like say a Eskimo or something. I don't mean to be in a negative way, but let's just take somebody who's lived out in the boondocks and never seen a microwave their whole life. Then the burrito comes out and it's not frozen, it's cooked. I mean, that's like the microwave is a black box. They don't understand it. They don't understand what's happening. So we understand how microwaves work, but the person who's never seen a microwave or used a microwave in their whole life will not understand it. So they call it a black box, meaning they don't understand what's inside the black box, how it works. They just know frozen burrito goes in, cooked delicious burrito comes out. As you can see, I have food on my mind this morning. If you have questions, feel free to type them up. Are we ready? So our patient is going to sleep. We're waiting for the anesthesiologist to make him asleep. He's being put asleep with propofol. Propofol is a sedative. It does not do anything for pain. So even though we put him to sleep with the sedative, we still have to give him some pain medicine. Otherwise, what I'm about to do would be very painful. Let's see why it's painful. Jordan, show us the x-ray. Anthony, go to the x-ray view. You can see the dilator, right? It's sitting right there where the herniation is. You see this little faint dye right there? That's the herniation right there. You guys see the shell? Show the shell of dye. See the black line? No, not there. Yeah, right there. And then you see the tear in the back wall of the disc where the dye is leaking out. That's the dark stuff is leaking out through the tear. There should be no dye leaking out, but there is. Am I ready? Yes. All right. We're going to enter his disc through his tear. You see how the dilator goes right through the tear. That's the beauty of our laser surgery here at Deuk Spine, is that we don't create any more damage for the patient. We are not doing any damage to his body except cutting his skin. He has a little bit of bleeding, maybe a few drops of blood. But we're going right through a natural opening in the spine, so we don't have to remove the lamina or the facet or the ligaments that other surgeons are taking out during their surgery. When they do a microdiscectomy, they're taking bone that you need out. It's called a laminotomy. They're taking half of your lamina out. You need that lamina. It holds your spine together. And they're taking out your ligaments, your interspinous ligament, your ligamentum flavum. They shouldn't be doing that, but they do it anyway because that's the only surgery they know how to do. That's the surgery I was doing 30 years ago. But you have to evolve and start adopting new technology as a surgeon and give your patients better treatment. That's what we do at Deuk Spine. So we've evolved past what other surgeons are doing to better procedures for the patient. By better, I mean better results. Number one, we have better pain relief of back pain than any other surgery in the world. This surgery has the highest relief of lower back pain. The Deuk laser disc repair procedure has the highest relief of lower back pain in the world. Are we still streaming?
Yes, we are.
All right. So the Deuk laser disc repair has an average of, why is it so dim? An average of 99.6. That's the wrong one, I think. 99.6% elimination of lower back pain. What that means is if we were to take 500 patients that we do this exact surgery on them and ask afterwards how much of your back pain that you had before surgery in those disc area, how much is gone? The average is 99.6%. So if you're a patient coming to Deuk Spine Institute to get rid of your back pain and you do the treatments that I'm recommending for your back, you can expect 99%, because that's our average, of your back pain to be gone when you wake up from surgery. And we have thousands upon thousands of patients that we've treated over the years. The last 20 years I've been doing this laser surgery. We've had a 99.6% elimination of back pain. Now earlier on, when we first published our results back in 2011, 2012, this was, what is that, 14, 15 years ago, our results were about 90% elimination of back pain. But we've gotten better over the years. So we figured out diagnostically that there's other things that cause pain besides the disc. And we've developed pioneering state-of-the-art treatments for those other causes of back pain. Okay? They include your facet joints, as you saw in our video. The SI joints do become painful in a lot of people, and the piriformis muscles. If I took all people with chronic back pain, 99% of back pain comes from the discs, the facets, the SI joint, and the piriformis muscle. And until today, when Deuk Spine Institute pioneered and patented the newest and most advanced treatments for those pain sources, patients didn't have a choice. They didn't have any options to get rid of their back pain. You couldn't find a cure to your back pain. You would have to get shots. You'd have to take pills like gabapentin, Neurontin, or Lyrica, pregabalin, or narcotic painkillers like oxycodone, OxyContin, Percocet, Dilaudid, and others. Or you'd have to take anti-inflammatories like Celebrex, ibuprofen, Motrin, Naproxen, Aleve, Goody powder, BC powder, meloxicam, those types of anti-inflammatories that obviously have side effects like destroying your kidneys or increasing your cardiovascular risk of stroke. So people could only treat their back pain with medicine or shots or therapy, which doesn't work. Physical therapy never fixes any of the 30 causes of back pain because Physical therapy is great for maintaining flexibility. It's great for maintaining muscle tone of your muscles and mobility of your joints, but it doesn't eliminate the source of back pain, because none of those 30 causes of back pain are treatable by physical therapy or chiropractic. They're all palliated, meaning they feel better for a little while. A lot of people with back pain say they go to the physical therapist and they end up feeling worse afterwards. Well, let's show our audience, Anthony, how it is that a disc injury such as this patient's herniated disc, bulging disc, can actually cause so much back pain.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from our animation video that the cause of all back pain that is discogenic, meaning coming from a disc. By the way, genesis means to originate from, the origin, the beginning. So the beginnings of back pain, the origin of back pain, is discogenic in 85% of patients as the primary cause, the main cause. The primary cause of back pain 85% of the time is the disc injury. Now the average patient has 2.5 discs that are causing their back pain. So if you look at our data, 5,000 patients with laser surgery or back pain diagnosed in clinic, you'll see that we've treated about 3,000 of those 5,000 and with laser surgery, and the result is a 99.6% cure of their pain. So what does that mean? If we're just treating the disc and nothing else, we're not touching any other thing in their body, we're going past everything else, just going to the disc and doing the annular debridement, then what you have is discogenic pain being responsible for people's chronic back pain as the primary source in 85% of patients. Now, any questions from our audience?
Yes, we have a question from Lanu on YouTube.
Well, Lanu, good to hear from you again.
Last year you mentioned you were working on your flower garden. Are you still working on the garden this year?
Yeah. Yes, Lanu. I have an orchid garden. Actually, I grow orchids, bromeliads, begonia, and Japanese maples. Those are some of the plants that I grow. I have some fruiting plants too, like berries, pomegranates, but mostly it's orchids. I love orchids, especially an orchid called a Cattleya. It's my favorite. And I have about 1,000 orchids in my garden that I care for. And that's my hobby these days, that and a little bit of golfing. So I start my day in the garden every day at usually 6:30 in the morning, and I work in the garden to get everything done that I need to. Then I head to surgery. I have a large collection of Cattleyas. They're my favorite. I have some of the most beautiful Cattleyas in the world I collected. Like if any orchid lovers out there, there's a type of Cattleya called Cattleya dowiana aurea, which comes from Colombia and Puerto Rico. It's tropical, obviously, which Florida is great for growing tropical plants. But yeah, sun, humidity, rain. It's actually been raining too much lately. And when you get too much rain, because my orchids are all outdoors, you actually can hurt the orchids. So I've been struggling a little bit in the last few weeks because it's been raining virtually every day. And the orchids can get too much rain. It triggers infections, which I'm sort of pioneering some new treatments for those infections. Any other questions?
Yes, we have a question from Rose on YouTube.
Hi Rose, welcome to our stream. Thank you for being here.
I wish I lived closer to you. I've had 2 back surgeries in 2 months, with the last one being in L5-S1 fusion.
Sure.
I'm still in so much pain from my L4-S5, still herniated.
Yeah, Rose, don't let distance keep you from achieving success with treatment of your back pain. You really should come to us because we can fix your pain. And all you have to do is a free MRI review. We don't charge people for these reviews. As long as you have an MRI after your surgery, if you don't, tell your surgeon you're still having pain. They need to check you over, make sure you don't have an infection in your spine. Infections are a common cause of back pain after spine surgery, not with our surgeries, but with invasive surgery like laminectomy, fusion, artificial disc, microdiscectomy, spinal cord stimulator. Those types of treatments do cause infections. But Deuk laser disc repair, what we're doing right now, we've never had an infection. Never. So it's worth it. Whatever you got to do, Rose, the pain will not go away on its own. Come to Deuk Spine, let us fix it for you. But start with our free MRI review where I can tell you what's wrong and how we can fix it. Then you can find out exactly what's needed before you come here. We make it as convenient as possible for people with our free MRI review. It's done over Zoom, so all you have to have is a computer or phone with a speaker and camera. That way I can do a quick examination and diagnose your problem. Thanks for joining us. We're just about finished with L4-5. If you look to the left, you can see the end plate of L4. That's the inferior end plate. You can see on the right the superior end plate of L5. So we've cleaned this tear completely. This is an annular tear debridement. We call it an annular debridement for short, but we're debriding the annular tear and getting rid of this part of the herniation that's stuck inside this tear. This is where the back pain comes from, as you can see. Let's show the audience how the Deuk laser disc repair surgery works.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
I like that. Yeah. Black Waters or something like that. So we're just about finished. We're talking about movies. There may be more questions, but I want you to see we're done here. You see that area there, that chasm or gap? That's where the herniation was. It's now gone. And what you have left is the epidural space, and that will seal off That's going to completely seal off. And the body will heal that tear right there. Now remember, the inside of this tube is 5.5 millimeters, 5.2 millimeters. So that tear is about, 2 to 3 millimeters, okay? Your body can heal that easily in 1 year, and it's going to reseal it completely. And the pain is going to be gone as soon as he wakes up. Any other questions from the audience?
No questions?
The best part about it is that, look at this. The incision is just 10 millimeters. We made it a little bit bigger, but normally it's just 7. And there's no bleeding, and there's no pain medication. He's going to go home with Tylenol, no narcotics. So it's wonderful not to have to take narcotic painkillers. If you have invasive spine surgery, laminectomy, discectomy, fusion, artificial disc, spinal cord stimulator, pretty much any of those other types of surgeries, you have to take opioids afterwards. The doctor is going to give them to you because you're going to be in so much pain. Anybody wonder why patients that have invasive surgeries like microdiscectomy, laminectomy, foraminotomy, and spinal cord stimulator and fusion, why they have so much pain after surgery? Anybody ever wonder why? You may say, well, because they had surgery, but that's not true. This patient has surgery. Thousands of our patients have surgery, but they don't have pain. Why? Why doesn't my surgery give them pain? The answer is simple. The only damage we do to their body is that cut right there. If you have that cut, you're not going to need pain medication. Okay? So it's the atraumatic, no trauma inside. But the people that have the invasive spine surgery, the surgeons are slicing and dicing and chopping your body up. You're getting muscle damage. You can see it after surgery and the MRI. The muscle's dead. We have them. You have ligaments being cut. You have bones being drilled open and cut out. You have all kinds of damage to your body. That's why it hurts so bad. That's why the surgeons that do microdiscectomy, laminectomy, fusion, that's why they have to give you pain medicine afterwards. Our patients don't take any pain medicine because we're not slicing and dicing internally. Your body is pristine. It's beautiful when we're done. Okay? Shot? Any questions?
No questions?
Well, let's show the audience, the Deuk laser disc repair versus other types of invasive treatment. Hi, I'm Dr. Deukmedjian. We've just completed our free MRI review at Deuk Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Deuk Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk laser disc repair. We've been performing the Deuk laser disc repair since 2006 here at the Deuk Spine Institute. To date, we've had 0 complications. The Deuk laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. Welcome back. You see from our video that our surgery is different than what other doctors do. And in my opinion, I've done all those surgeries many times, thousands of surgeries that are invasive in my career, but now I don't do them anymore because they're not necessary. In most patients, you don't need fusions and artificial discs. Okay? Grab her. What you need is the right surgery targeted to a very small spot where your pain is coming from. In this case, look at this. This tear right here at L5-S1 is causing half of his back pain. So if I fix this by doing a debridement, I'm targeting exactly the source of back pain, rather than shotgun approach, trying to shoot all the different causes with steroid shots or fusion. Those surgeries end up creating more problems for patients. Even steroid shots are not good for your body. Doctors don't tell you they're not good for you because they want you to get the steroid shot. They tell you, oh, it's just a shot. But when you keep getting steroids for so long, you can get all kinds of problems. Look up avascular necrosis of the femoral head. You can actually have your hip melt away from too many steroid shots. Okay, thanks for joining us. We're done. Our patient had 2 discs repaired, L4-5 and L5-S1 with the Deuk laser disc repair, because he had herniated discs and bulging discs. And herniated and bulging discs, which are the same as a slip disc, those kind of problems are best treated with Deuk laser disc repair, not anything invasive. Success rate 99.6%, elimination of pain. Thanks for joining us. Any other questions?
No questions.
Great job, team. Thank you all. Let's show the audience one of our patients who had the Deuk laser disc repair and share their experience. I'm Dr. Deukmedjian. I'm here with one of my lovely patients who came to Deuk Spine Institute with a problem with his lower back. I can tell you he's had a laminectomy before. It didn't work. He looked us up, came here yesterday, had the Deuk laser disc repair. We fixed 5 areas on his discs. And how are you doing today?
I'm very emotional. I got home yesterday and the sunset was behind me and my wife took a picture of me thanking God for what happened to me yesterday. I've had back pain since 1973. I got hurt in the Army, putting helicopter blades back on a helicopter. I lived with it for over 50 years, pain. 3 years ago, the VA decided to cut 3 bones off my spine. I've been unstable and on a walker ever since. My life has deteriorated immensely. I was 280 pounds 3 years ago. I'm barely 200 pounds now, and it's not because I wanted to lose the weight. All my muscle is gone because of what happened before.
And did the VA surgery fix your problem?
It made it worse.
That was a laminectomy.
That, when they cut the bones off my spine, whatever you call it. But the thing about it is that after that, it took me 3 years to even get them to, I was at 30% disability to begin with, and it took them 3 years to get me to 80. And then now I'm at 90, but I haven't been able to work. I haven't been able to mow my lawn. I can't ride my Harley Davidson anymore because of the surgery that they did, the instability. I've been in the ER 15 times since that surgery from falls. It's the worst feeling in the world to be a 280-pound farm boy down to a 200-pound, very weak-minded, weak strength. I can't get up and go do anything without a walker or somebody with me until yesterday. What you did for me yesterday, there's no amount of thankfulness that I can show you or tell you, except that I took you for a man of your words and you came through for me. I walked in here without my walker. I've been walking around this morning without my walker, and I don't feel like I'm going to fall. I'm not afraid anymore. I got hope again. I got hope to be a man again and
Good.
Be self-worth.
You had the Deuk laser disc repair. We went in and fixed 3 discs, but 2 of the discs from both sides because the nerves were being pinched on both sides. And now you're walking without the walker. You feel like a new man.
I feel like a new man, but hopeful to be a great man again. And I thank you with all my heart. My family thanks you.
You're welcome. And you can see in the surgery we did on your back that we went in with the laser and we cleaned out the tears and got rid of the herniations, and now your discs will heal naturally. We didn't put anything artificial in your back. You have your natural spine. You didn't need the laminectomy that the VA did. It was unnecessary and it put you through a lot of pain and suffering. Are you on any pain medication today?
You know, I didn't even take Tylenol for my neck at all. I have no pain anywhere in my body. None. I can feel one spot that it feels like something happened there, but it's not painful at all.
Well, is there anything you want to tell your people out there?
Anybody needs to check with this clinic and this man right here and the staff here is just absolutely unbelievably wonderful. I got treated with so much dignity and fun. Actually, yesterday, it was a blast. Anybody that has questions, do not allow people to cut into your back until you do research. And this is where you need to start your research.
Thank you. Thank you.
I appreciate it so much.
Well, we love our patients, and we especially love our veterans who are patients.
This one sure loves you, buddy. Thank you so much.
Take care. You take
God bless you all.
Thank you.